We're going to talk about informed consents. At University of California, the Irving Office of Research states that informed consent is the process and actions that take place as you learn about and think about a treatment before you agree to it. In seeking an informed consent, the following information must be provided to each subject: an explanation of the purpose and reason for the informed consent, what it involves, risk and benefits to the patient. The risks and discomforts can include physical, psychological, social, and economical harm. The benefits to the subject should be clear and not overstated. The expected duration of the subject's participation should also be stated. A disclosure of appropriate alternative procedures or course of treatment, if any, that might be of advantage to the subject, which means the patient has to be of the right state of mind to make these informed consents. If the patient is unable to, then an advance directive, which will be discussed next, should be the next step forward. Identification of any products which are experimental, as well as if harm or injury were to occur, what kind of compensation and or medical treatment the patient would be able to obtain. An explanation of who is all going to be involved in the procedure and care. And lastly, an explanation of whom to contact for answers to pertinent questions about the procedure. In most cases, it's updates from a doctor or a nurse. Patients do have the right to refuse, and the patient should always be made aware of the consequences if they do refuse. The difference between consent and informed consent, as stated by the American Cancer Society medical and editorial team, states that in order for it to be considered an informed consent, there's a process that includes a couple steps. You are told about the possible risk and benefits of the treatment. You're told about the risk and benefits of other options, including not getting treatment. You have the chance to ask questions, get them answered. You have time to discuss the plan with your family or advisors. You're able to use the information to make decisions that you think is in your best interest, and you share your decision with your doctor or treatment team. You are then asked to sign a consent form. This is a legal document that lets the healthcare providers go ahead with the treatment plan. From a doctor's viewpoint, informed consent means that a doctor or nurse must make every effort to be sure the patient understands the purpose, benefits, risk, and other options of the test and treatment. Then the doctor or nurse must get the patient consent before starting. In some cases, even a simple blood test or a shot requires a written consent. As long as adult patients are mentally able to make their own decision, medical care can be began. If not, it cannot begin unless they give informed consent or have their power of attorney. If the patient is a minor or has a serious mental disability or cannot give consent, then the parent, legal guardian, or person authorized by the court must give consent for the treatment. Now we're going to go over advanced directives. The National Hospice and Palliative Care Organization states that advanced directives are legal documents that allow you to plan and make your own end-of-life wishes known in the event that you're unable to communicate. They consist of living will and medical power of attorney. The living will describes your wishes regarding medical care, while the medical power of attorney appoints a person you wish to make the health care decision in case you are unable to speak for yourself. Make sure that the person you pick feels comfortable and confident about the type of medical care you want to receive and is okay with making those decisions. Make sure your patients know about end-of-life decisions to help them prepare for their advanced directives. Life-sustaining treatments are specific medical procedures that support the body and keep a person alive when the body is unable to function on its own. These usually include cardiopulmonary resuscitation, or CPR, which consists of cardiac arrest or respiratory arrest. So cardiac arrest, you usually have chest compressions, medications, different ways to kind of support the heart's ability to function, while respiratory arrest, they put in like a tube down the throat and the trachea to help support or restore breathing function. Do not resuscitates or do not intubates are also other things that you need to discuss. These are written physician orders that prevent the healthcare team from initiating CPR or performing intubation. Now, the patient needs to be made aware that this can be canceled at any time by letting the doctor who signed the DNR know that you changed your decision. And lastly, artificial nutrition and hydration, which allows a person to receive nutrition and hydration when they're no longer able to. So these are all things you need to discuss in case of an emergency. If any advance directive is not completed, then healthcare professionals must consult family members, starting with spouse, then parents, then adult children. The National Health, Hospice, and Palliative Care Organization, your state hospice organization, local hospitals, public health departments, state bar associations, or states that or state agent offices provide specific forms and instructions on how to prepare an advance directive. And then you just make sure you have copies, give it to your alternative person in case something happens, as well as your providers and different people who are involved in your care.